So we were increasingly aware that there were a lot of cultural practitioners and cultural organisations who were working within this space, going into kind of medical schools, nursing schools, dental schools, to work with healthcare students and also healthcare professionals after they've qualified. But we had to refine the focus slightly for the review because it was a rapid review, so we decided to focus on student training and development. Things that came up most frequently were the role of theatre, and specifically improvisation and role play, in enabling medical students but also nursing students to develop more understanding of patient perspectives and kind of develop that empathy with what patients are going through when they're receiving medical treatment or healthcare treatment. And then there was also emerging findings around this idea that cultural programs, specifically gallery-based programs, can improve observational skills. So students went into galleries and the staff at the galleries would talk them through different techniques for looking at pieces of artwork. So whether that was looking incredibly closely and seeing what you could see close up versus far away, to understand the motivations of the artist who'd created the work. And then a range of methods were used to understand whether that had improved observational skills. This wasn't particularly strong evidence because of the way that it was evaluated, and there's still a way to go to be able to say gallery-based programs, for example, have a direct influence on observational skills. But I think there's something there that warrants further exploration. One of the organisations that we've been having conversations with who does really good work in this area is Clod Ensemble, and they have a programme called Performing Medicine, which is represented in one of the studies which is included within this review. And it's a kind of multi-arts, multicultural experience programme that enables healthcare students to develop their kind of empathetic practice, reflective practice, and getting their head around the kind of principles of person-centred care within their own practice. So I would say the main gaps at the moment relate to the kind of participants that are involved. So 3/4 of the studies included medical students as the key population of interest, so there was much less representation of other healthcare students within the literature. And I think this is important because obviously some of these core skills that are coming out are applicable beyond medical students to other healthcare trainees. And then the other thing is that a lot of the research was very short term in nature and very, very small scale. So they used participant feedback forms as their main source of evaluating the activity. And given the fact that a lot of these were voluntary and maybe 1 or 2 sessions, you've got to really disentangle what lasts after the session time. Are people just having a really good time in the moment and they have these skills that they think that they've developed, but actually how does that relate to their practice? How do they take these things forward? I think there's a real need for investment in research within this area to be able to say with confidence that these things have an actual influence on practice above and beyond the kind of role play and simulation that is done as part of the more traditional learning curricula anyway. So what role do cultural organisations and practitioners play above and beyond those more traditional teaching methods that maybe use role play and simulation in a different way?